Hey there, runners, walkers, and relay junkies. This is Peter Schrey from Focus Physical Therapy coming at you guys with another video. Today we're talking about another injury that's very common in runners, and that's runner's knee or patellofemoral pain syndrome. One of the most common injuries we see in runners. This injury can cause pain and swelling underneath the kneecap and can definitely sideline your runs. We see this most typically in newer runners, when you're ramping up your miles and intensity too quickly in a training program, and any of the other injuries to the hips, knees, feet, or ankles can kind of come along with this sometimes. There's many possible biomechanical causes, including poor kneecap tracking due to weak feet and ankles, weak hips and glutes. Both can cause an unwanted inward rotation of the knee or poor tracking of the kneecap. Underlying arthritis and other joint changes that can affect the mechanics of the leg as well. So a big question we get is, can I run with it? You want to make sure first that you're activating the right muscles. Muscle imbalances are a really common thing that we see with this condition. Hamstrings, quads, hip abductors, hip adductors. You got to know when to stop. Fatigue can really worsen that instability around the knee. Choose more uphills. You're going to recruit the opposite muscle groups more, like hips, hamstrings, glutes, things like that. And you want to try and reduce your mileage. You're also going to end up reducing some of the impact you'd get if you were running flats or downhills. Think about a form checklist. Once again, just like with the Achilles, you want to be picking up your cadence. About a 5% increase in your cadence can be a 10% reduction in forces in those knees. This will help prevent overstriding, but it does require a little bit more power, so you want to plan your pace accordingly. Relax your ankles. A hard heel strike can definitely worsen the impact forces. You want to lean into it a little bit, from the hips, not from the back. This is going to shorten that lever arm on the kneecap and reduce some of that compression. How to manage it? Well, you want to make sure you cool it down if it's really inflamed. Cold packs, game-ready ice compression, cold pools, even a dip in the river. Make sure you don't stay in too long, don't let that skin turn white. Repeat this frequently for the first 24 to 48 hours. Beyond that, don't need to ice quite so much. You want to make sure you keep it moving, bending and straightening that knee frequently. Start in a small range and progress as your joint loosens up, about 15 to 20 repetitions every couple of hours for the first 3 to 4 days, and then for maintenance after that. Make sure you're activating those right muscles. Practice contracting your glutes, hamstrings, hip flexors, do those ankle pumps, and rocking to keep your calves loose. You want to make sure you keep your other joints mobile. Do our dynamic warm-up for your hips, ankles, pelvis, and trunk. 1 hour or more before you start your run, stretch out your hips and knees well. Target the outside of the hip, the knee, the quadricep muscles. And you want to unload or offload it if you can. Braces, kinesiology tape, over-the-counter insoles for your running shoes. If you're treating yourself during an event, just make sure you test it if possible before your race, trip, or even that relay leg to make sure it's going to work for you. Another big question we get is, well, when should we actually come see somebody about it? If it's been more than about 3 weeks, you want to make sure you go see your sports physical therapist. Treat both locally and globally. You want to take care of that kneecap and also correct your form, whatever is off with your biomechanics. For more info and videos, subscribe to our YouTube channel, Focus Physical Therapy, and go to the Cascade Lakes Relay website where the videos will be there as well as some more information, or you can contact us at focusptben.com. See you guys out there.